Imagine finishing a busy shift. You've cared for 12 patients, answered countless call bells, administered medication, completed documentation, supported relatives, helped junior staff. You finally sit down, exhausted. Then someone says, "Can I speak to you about something that happened earlier?" Your heart starts racing. Every nurse knows that feeling because one of the biggest fears in nursing is making a mistake. But here's the question. Does making a mistake automatically mean you've been negligent? The answer is no. Unfortunately, many nurses live with unnecessary fear because they don't understand the difference between an honest mistake and negligence. Today, we're going to clear up that confusion once and for all. At the end of this video, you'll understand what negligence actually means, why honest mistakes can happen even to excellent nurses, what employers and professional bodies usually look at after an incident, and most importantly, what you should do if you ever make a mistake. Let's begin. Welcome to Nurse IQ, where we learn nursing smarter, practice safer, and save lives. Subscribe for practical nursing education every week. Why every nurse makes mistakes. Let's start with an uncomfortable truth. Healthcare is delivered by human beings, not robots, not computers, human beings. Even the safest, most experienced nurse can make an error. Research from around the world has shown that healthcare systems are incredibly complex. Every day, nurses work with hundreds of medications and numerous medical devices. They manage multiple patients amid interruptions and emergency situations, all while facing staff shortages, fatigue, and intense time pressure. It's a challenging environment. Despite everyone's best efforts, mistakes can happen. The goal of modern healthcare isn't to pretend mistakes never occur. The goal is to create safer systems that reduce risk, encourage learning, and improve patient outcomes. Section 2. What is an honest mistake? An honest mistake is exactly what it sounds like, an unintended error, something that happened despite your genuine effort to provide safe care. Imagine this example. You carefully check a medication, the patient matches the medication label. Everything appears correct. Later, you're informed that the medication had been incorrectly labeled before it reached your ward. You followed the correct process. The problem occurred elsewhere in the system. That doesn't automatically mean you were negligent. Or imagine another situation. A patient's blood pressure suddenly drops after receiving a medication that had never caused problems before. You assess the patient immediately, escalate promptly, call for help, document accurately. Even though something unexpected happened, your professional response protected the patient. Honest mistakes can happen. What matters is how we respond. Now let's talk about negligence. Negligence is more than simply making a mistake. It's a legal concept. Although the exact legal test varies by jurisdiction, negligence generally involves a failure to provide the standard of care that would reasonably be expected in the circumstances, leading to harm. Let's use a simple example. Imagine you're about to administer insulin. Hospital policy requires you to check the patient's identity, confirm the prescription, verify the insulin type, and check the dose. Instead, you skip every check because you're in a hurry. The medication is given to the wrong patient. That raises very different concerns. The issue isn't simply that a mistake happened. It's that established safety procedures were ignored. Professional investigations look carefully at the circumstances surrounding an incident rather than assuming every error is negligence. Let's look at a real-life scenario. A nurse is caring for 6 patients when a pharmacy label has a dispensing error. The nurse completes all the usual checks with the information she has, but the error is identified later. An investigation examines what happened, why it happened, and if procedures were followed, and whether system factors contributed. In scenario 2, a nurse is interrupted 3 times while preparing. Instead of restarting the checking process, she continues from memory. Okay, Naprolol 25 milling for room 305. Sorry, 1 second, almost done. The wrong medication is administered. Wrong medication was administered. During the investigation, was safe practice followed? And did an interruption contribute to the error? Scenario 3, a patient's condition begins to deteriorate. The nurse notices but decides not to inform anyone because the doctor will be here soon. Several hours pass. The patient becomes critically unwell. One important question in the review may be whether concerns should reasonably have been escalated sooner. A newly qualified nurse is asked to do a procedure she isn't trained for. She feels uncomfortable but doesn't want to seem inexperienced. The procedure goes wrong. One key lesson here is the importance of recognizing the limits of your competence and seeking appropriate support. What happens after a nursing error? Making a mistake is frightening, but what you do next can make an enormous difference. Step 1, put the patient first, assess them immediately, provide any necessary care, call for help if needed. Patient safety always comes before worrying about blame. Step 2, escalate promptly. Inform the appropriate senior clinician, nurse in charge, or prescriber according to local policy. Never try to deal with a serious incident alone. Step 3, document honestly. Write factual information. Record what happened, the patient's condition, your assessment, the actions taken, and who was informed. Avoid speculation or altering records. Step 4, complete the incident report. Incident reports exist to improve patient safety and support learning. Reporting an incident is an important part of professional practice. Step 5, reflect and learn. Ask yourself, what happened? Why did it happen? Could anything have prevented it? What can I do differently next time? Reflection helps improve future practice. Why do nurses sometimes hide mistakes? They're afraid of losing their job, being judged, or embarrassment. They're worried about investigations or damaging their reputation. These fears are understandable, but hiding mistakes delays care and prevents learning. We must prioritize honesty and patient safety. Many healthcare organizations aim to encourage openness and learning while maintaining accountability. How to reduce your risk? No nurse can eliminate every risk, but you can significantly reduce it. Always follow the 5 rights for medication safety. Use checklists, read policies, and ask questions. Speak up if something doesn't seem right. Never work beyond your competence. Take breaks, minimize interruptions, and escalate early. And continue learning throughout your career. Safe nursing isn't about being perfect, it's about being prepared. If there's one message I want you to remember, it's this. Making a mistake does not automatically make you negligent. Healthcare is complex, patients are complex, systems are complex. Professional practice is about recognizing risks, following safe procedures, responding honestly when things go wrong, and continuously learning. The best nurses aren't those who never make mistakes. The best nurses are those who are committed to safe practice, speak up when something is wrong, and put patients first, even in difficult situations. Thank you so much for watching. If this video has helped you better understand the difference between negligence and an honest mistake, please give it a thumbs up and subscribe to Nurse IQ for more practical nursing education, legal guidance, and patient safety tips. In your opinion, what is the biggest factor that contributes to nursing mistakes? Workload, interruptions, lack of staffing, poor communication, or something else? Share your thoughts in the comments, but remember, never discuss identifiable patient information or confidential workplace details. Until next time, stay safe, keep learning, and remember, great nurses aren't defined by never making mistakes. They're defined by how they respond, learn, and continue to provide safe, compassionate care.